Hi. So welcome to the Masters in Healthcare Data Science information session. Before we start, we just wanted to let everybody know that the session is being recorded and this will be shared on the ICE YouTube channel after, and that will also be sent to anybody who registered for the event as well after the session. So my name's Rosie Alsop. I'm an Academic Centre Coordinator at the Institute of Continuing Education at the University of Cambridge, which is also known as ICE. And I'm joined today on the panel by Fatima, the course director, and Mary, who is one of our student representatives. Today, the panel, we have course director Fatima, and we also have a representative from the enrolment team and the marketing support team as well. Can we have the next slide, please? So this week is our ICE Medical Open Week, and so we're running a variety of online sessions which are aimed at giving everybody an opportunity to find out more about the medical courses at the Institute of Continuing Education. The courses like this one cover each course in our portfolio. So yesterday was the pre-medical studies and genomic medicine. Today we've got healthcare data science and dental education, and tomorrow is clinical medicine and medical education. If anybody is interested in any of those other sessions, then they are available online if you haven't attended them. The recordings are available on the ICE YouTube site, as this one will be as well. And links to the events and resources will be shared in the chat as well, so have a look at that. Could have the next slide. So the Institute of Continuing Education was established about 150 years ago, just had our anniversary in 1873, and we were the first university-led continuing education provider in the world. Today, we offer a wide range of courses to adult learners, including short courses, residential weekend courses, international summer programmes, and award-bearing part-time undergraduate and postgraduate qualifications. Lots of subjects ranging from archaeology to genomic medicine, and we also act as the admitting body for MST courses within the University of Cambridge, and that's Master of Studies. So our Master of Studies students become members of a Cambridge college when they join their course. Can I have the next slide, please? As an MST student, you become a member of a Cambridge college when you enrol. So you'd have the same level of support that all Cambridge students have. So this is access to standard college resources. You'd be allocated a college tutor who's responsible for your welfare and pastoral support, as well as the college confirming arrangements for your university card, matriculation, things like that. We work with a number of different colleges. We've not quite confirmed that for the healthcare data science course yet, but we do work specifically with particular colleges within the university who are really well set up for part-time postgraduate students who are studying and working at the same time. So the support is there for that. You can state preference for a college. If perhaps you've studied at Cambridge before, have a particular link with a college, then we could support that. But we tend to recommend that a cohort goes with a particular set of colleges that we have a pre-existing relationship with. Please do talk to us, though, if you are already a member of a particular college that will be willing to support you, and we're happy to have a look into that for you. Can I have the next slide? So today's session, we're just going to take you through what you can expect from the MST in healthcare data science, things about entry requirements, teaching, module content, assessment. You'll also hear from one of our previous students, Mary, who's with us today. And at the end, the enrolment team will also talk about what kind of support we can provide for the application process. And then right at the end, we've got some time reserved for a question and answer session. So please do pop your questions into the chat. We've got somebody typing away who will answer, or we'll answer these at the end of the session as well. So I'm going to hand over to my colleague Fatima, who's going to sort of take you through a little bit more detail about the content of the course.
Great, thank you very much, Rosie, and welcome everyone. Great to have you here, or if you're listening later, thanks very much for your interest. So I'm going to take you through the course structure and the team, and really how you're going to get assessed and what you need to do while you're residing in your 2 years MSc program. So the MSc in Healthcare Data Science course has been established in 2019 by a fantastic group of Cambridge academics and clinicians from Cambridge University Hospitals. this year, we had the opportunity to revive the content and structure of the course. And as you can see, a new content is offered over 2 years, and the core 8 modules will really designed to give you a current suite of skills in the field. Um, and as we all know, the healthcare data holds a great potential for both data-driven approaches in healthcare as well as innovative approaches in diagnosis, prognosis, and treatment of patients. And we are all hoping that being able to work with patient data gives us the ability to save lives. So it's at the heart of it is saving patient lives and improving the healthcare services. So the innovative approach is at the part of our efforts for this reviving of the contents. And we achieve this in a few ways, both within the current structure of the course, where we focus each module on the skills required to enable you to address a specific areas of a collaborative healthcare data science project, as well as connecting you to the society and the social, give you the social interactions required for you to refine the ideas and be able to really enable that innovation within your current approaches or your future practice. So as you can see, the 2 years the 2 years program comprise of 8 modules. On your first year, you have 2 modules per term. And on your second years, your MicroMasters term or your first term from October to December is the first 2 modules. And then you're entering to 2-year block for your dissertation module. If I may have next slide, please. So in each one of these modules, as I mentioned, have a core skill set that is required for you to be an effective player in a collaborative healthcare data science project. So the first module, we are focusing on data-driven decision makers. And this is really aimed to give you a broad vision of what is happening in the field, what skills you require, and then delve deeper as you progress throughout. So there is a running thread that we hold across from the first module to the final module. Then we move into the module 2 that will get you familiar with the techniques and the principles of healthcare data science. In our second term, we go through the advanced health data science and data visualization, which is a very key element to be able to communicate your results both with your colleagues and probably same-minded people, as well as to patients, to stakeholders, to policymakers. So this is a key skill that we will focus on in your second term. And on your third term in the course, we will be looking at machine learning methods and databases. So most of these healthcare data are held within big databases, and a knowledge of database and systems and how they operate really enables you to get hands-on experience. That is also aiming to get you ready for your second year, because on second year, what we are offering you is to work directly on patients' data within trusted research environments. So you will have the opportunity to run your data analysis and inference on the actual patient data before moving to your more independent dissertation project. If I may have the next slide. So the academic team, ever expanding. This is the team that has been contributing to revisions of the course and restructuring and developing different approaches. But we are ever expanding the course, bringing the academics who are at forefront of research in healthcare data science to ensure that you really have the ecosystem to enable you for that innovation. We believe that innovation is not a light bulb moment. It requires you to be in the right social context, as well as having the refinements of the ideas through the opportunity of peer review and also within the course. So next slide, please. So in terms of the teaching and assessment, you are expected, although it's offered as a part-time course, we really want you to benefit from getting into the fabric of Cambridge academics. And as Rosie mentioned, you will get matriculated on your first term in October. So you're going to get connected to a college. And in terms of the teachings are delivered in residential weeks where you need to be present at Cambridge. So they'll host you here in Cambridge, and you gain a very good experience by sitting in one room with very much of a diverse but same similarly minded individuals who are motivated by getting their hands on healthcare data science skills and knowledge. And that has came out from the feedback from our previous course students who found that networking is really key, both with the academics in the course as well as their peer learners. So between October till June, for each module, we have a residential week. We span it throughout the year so that your presence is required on a bi-monthly basis. The teaching is face-to-face, but the workshops that we hold, and we call them master classes, is one before you arrive to Cambridge, pre-module masterclass, and one after, so post-module masterclass, where you get opportunity to get set up for your days in Cambridge, to make the maximum of your presence, hopefully getting the ideas together, coming at the class very much equipped with the settings that you're required to have, because in some of the modules you will be hands-on technical stuff. So we'll get you ready so you're all set for the day. And then the post-residential master classes are aimed to tackle questions and really empower the discussions that is required, and take away any questions that you have and tackle them within the peer groups and within the academic teams before you submit your assignments. So the assessments are mostly a written piece of work for each module, and it comes in a written format, but the mode of the assessment might be different. For example, you might be asked to generate a portfolio or a poster or an essay, for depending on which modules you're sitting. And for some of the modules, the questions that you will be required to answer in your portfolio is going to be a technical questions, and you will be provided with the data and resources required for that. Next slide, please. So the modules assignment are a little bit different to your dissertation. So your dissertation is really showcasing your independence, and it requires to capture the skills that you acquired throughout your 2 years of experience with us. So in the dissertation module, we are not going to put you on autopilot. You will still be supported. You are going to have 2 residential blocks in January and April of your final year. And on those, we will develop a research proposal together. We will submit our data access request to the research environments that you're going to work in. And you're required to then develop your project in a body of 10,000 to 12,000 dissertation For the dissertation module, you will also have a one-to-one supervision with an academic whose interest is closely matched to your research proposal. And you will also have the opportunity to present your work in academic conferences. We offer symposiums locally at Cambridge. So Cambridge, as you know, we have a rich academic and research environment. So you can present at more local events, but we're also happy to support you in getting your work presented in international and national conferences if that is a fit. And if I may have the next slide, please. So as part of our revisions, we are holding that innovative mindset. We are here to enable you to be a competitive player in the field of health data science. And for that, we decided to make another pathway to really facilitate your learning, and that is the MicroMasters. So the first module of the course is offered as a MicroMasters, which is a fully online course that we are building at the current moment, but it will be available to you on April this year. And you will be able to complete that. And once you've submitted your capstone assignment, you can enter the course via the MicroMasters pathway. And you can start your course from module 2 if you have successfully finished the capstone assignment. We suggest that if you're intending to choose that as your entry pathway, to send us a notice or notify you. There is options to notify us from the edX platform or just directly contact us. If I may have the next slide to show you a little bit more on the MicroMasters pathway. It allows you to progress on your own pace. So if you're looking for this year's entry, you have the April, and then you have the time to finish the content of what is equivalent to first module, and then enter to the full MST course. As you can see, I put a screenshot from the capstone course. As you can see, this is the structure of the course. You will receive the contents from myself and the team who developed it. You will have the opportunity when you go on the pathway to MST to attend some live sessions and get one-to-one mentorship throughout your completion. So that is really trying to bring that residential experience into your experience. I think that is my final slide, and I'm handing over to Rosie.
Thank you. Yeah, so this slide just outlines the application process. So the deadline is the 30th of April 2025, which would be for entry in October 25. You can apply online. That link there will take you to the web page for the course, which has lots of details on it. It has an apply now link, but it also has an ask a question link. So if there's anything specific that you want to ask that's more personal to you and you don't want to ask today, please feel free. We do have some entry requirements for the course. So applicants will normally be expected to hold a 2-1 from a UK university or an equivalent. It's expected that the applicant's first degree would be in a relevant subject. But if you've got any questions about that, then please do let us know and we're more than happy to help. As part of the application, you would need your academic transcripts from any previous courses that you've undertaken, evidence of competence in English, 2 references and a CV. So that's what you'd need to complete the application online. So if we go to the next slide, I'm going to hand over to Mary, who has completed the MST in healthcare data. And if you could just tell us, Mary, a bit about your experience on the course and perhaps how it's helped you in your career.
Sure. Can you hear me okay? Be connected? Yeah, so I entered the MST in healthcare data on a slightly different path. I entered on a 3-year course, which was a little bit different. And that's because I was coming from a completely other area. My first degree was in English language and literature a long time ago. And then I had spent many years working in publishing, working in data standards, taxonomies, the kind of management of data, but in a completely other industry. And I kind of got to a certain age, fancied a change, and decided that I would go for the healthcare data course. And so I went through the standard application process. It was really straightforward. The system's really easy. I applied to a few courses around the UK. I'm based in the UK, I just don't sound like I am. And I applied for a few courses and found the Cambridge process really easy, and the communication was really good and really early. And one of the things I really liked about the course is that you knew exactly which weeks you were going to be attending. So I was in full-time work then. Things have changed a lot since I started the course 3 years ago. And so I could plan really easily when I would need to be taking holiday, when the residential weeks would be, that sort of thing. Help me, Rosie. Where shall I go next?
Perhaps how has it helped you in your career, or has anything changed for you since on the course?
Okay, great. So our course was structured slightly differently. It was the data science component and also an entrepreneurship and commercialization aspect. And that's the bit that I became very attracted to. I really like all of the data science side, but during my time on the course, I gained lots of connections. The time at Cambridge is amazing. All the residential weeks are really great. I was personally based in Homerton College, and that afforded me so many opportunities. There's other residential weeks, there's other courses you can attend. There's so many people willing to help you. And so long story short, I will I'm sure eventually be creating a med tech product, but I actually took my MST and the confidence and connections, and I've started a language technology product. So I have now set myself up with my own business, very different to what I thought at the beginning, which was that I would be employed in a similar type of data job that I was doing in publishing, but in healthcare. But the course for me, obviously there was the technical skills, but really I just grew a lot, my confidence and my network and connections, and that's something I have found totally invaluable. My course group, I saw a couple of people were asking about cohort sizes. It did fluctuate a little bit because some people had deferred, some people were on the 2-year course, 3-year course, so it varied sort of between 10 and 16 or something like that for the different weeks. We got merged with different courses. There was a bit of variation, but we stayed in touch really regularly for support. So you're there for a week, you meet people. We had a great time, became very, very close in those weeks. And then we have a WhatsApp group, and we would support each other while we were working on the assignment, and have absolutely made lifelong friends of those people. Some of them are in other countries, but it was such a good cohort, very diverse. I would say half of them were actively medics, medics in training, or coming already from later stages of medical training into the data side, and the other half were in either related medical jobs or entrepreneurs. Someone had come from finance, so a little bit like me, from a totally different industry, but with the technical side there and not the medical side. Yeah, very diverse cohort.
Great, that's really useful, Mary. Thank you so much. It's kind of useful to hear, from a student rather than from us just talking. So thank you very much.
Sure.
So the ICE enrolments team are our sort of dedicated team for helping with getting people on board, helping you through the applications process. They are more than happy to provide support As I said, there's an inquiries form, there's a QR code on the screen. So if you've got a phone out, and happily can scan that, and it'll take you straight to the ask the questions bit. There's also an email address, which is questions@ICE, and they will reply to that very quickly and help with anything you might need in terms of application support. So we're on to our Q&A. And there are a couple of questions in the chat, which I will just go through. So the first one we've got here is about what Mary mentioned about the class size. So Fatima, what are you sort of expecting for maybe this first iteration of the new course that we've got?
Great, a round of great questions coming up. So I think for the first round, we are getting ready for a cohort between 20 to 30. Having said that, we already have quite a few applications, so it is getting competitive. So if you're submitting an application, please provide as much details on your existing experience to convince us that we should keep you on the shortlisted and give you an interview. So yeah, be comprehensive about your skills and experience, and yeah, make sure you get in.
Lovely. Another one for you, Fatima, actually. How would somebody know whether they should do the MicroMasters or the standard pathway?
So it really depends on you. With the MicroMasters, we are hoping that it will bring the flexibility for you to do the course in your own pace, and it doesn't require attendance on the residentials. Although, as Mary said, we all see a great benefit to do the residentials. It is also, the MicroMasters is also for people who may want to get a feel of how is it to sit on a master's course. So it gives you a general feel of what is the context and what I am moving into. If you're, for example, same as Mary, deciding to change into the field of healthcare data science, that will provide you that opportunity. So there is no specific requirements for you to do that and then submit an application. So but that is an available pathway for you. So you can decide if you have time over the upcoming summer and you want to finish your first module and join us from the second module, just notify us and enroll yourself into the capstone assignment on the edX in April, and we will be able to have you on board from module 2 onwards.
Great. And there's a question here about funding. So if you get an offer on the course but can't secure any funding, can it be deferred? So we don't usually offer deferment at Cambridge. That would be only in exceptional circumstances. So if you're in a situation where you couldn't secure funding, probably the best option would be to withdraw the application and apply again in the following year for that one. Fatima, we've got a question here about the coding aspect of the programme. So what level would be expected at the beginning and how much training is given on that? And what sort of level would students be expected to reach in that by the end of the course?
So great question. And I can see you're already getting ready for jumping into the content and technical aspects. So in terms of the coding, it is definitely one of the core skills that we will enable you to exit the course with. So after your 2 years, you should feel comfortable coding in databases in 2 core languages, R and Python. But in terms of entry, as I mentioned, we connect you to Cambridge Fabric, where you have access to resources from library courses to very specialized courses in R, Python. So even if you are coming with no knowledge in computer science and codings, we'll ensure you have access to those resources and are able to have sufficient time. We will get started with introducing you to those skills in module 1. And that means you have sufficient time to use, to develop to the required skills by the time you're at year 2, where you need to be hands-on coding. So no expected pre-experience. Obviously, if you're coming from computer science, you probably feel very confident and comfortable using those skills. But if not, we are here to get you started and develop your skills in coding aspect of working with healthcare data.
Lovely, thank you, Fatima. The next question is about sort of what's the average age and career stage of students on the course? Is it aimed at early career professionals? It is aimed at mid or late career? So we really do have a mix, Fatima, don't we?
Yes, yeah, from early careers to senior leaders we had on the course. And I think, as I said, it's the multidisciplinary nature of this course. And we hold a vision that wherever you are, we want to enable you to be an effective collaborator in healthcare data science projects. If you're clinicians, if you're changing field, it is equipping you with the skills and also giving you that vision of what is happening in healthcare data ecosystem, providing you with that social aspect to enable your innovative approaches. Mary is a great example of that, where she started forming those ideas, use her existing knowledge and the knowledge gained in her course, and now she's establishing a whole new adventure. So it is absolutely open to anyone, everyone, as long as you see it a fit for yourself. Obviously, cover the details in your application. In the interviews, you will get some questions about why and why should we consider you. But if you get in, you we obviously are ready to and looking forward to have a very enriched multidisciplinary conversation at the class.
Great. So we've sort of come to the final question now. So somebody has asked, do they need to write a proposal for a dissertation and approach a supervisor now? So Fatima, we would, expect that in the second year very much. You might ask a question about it in the interview if you've got anything particular planned. But very much at the beginning, it's not that stage yet.
No, it's not like a PhD program. So we are really getting you ready for that level of independence by the end of the course, but we are not expecting you to write a proposal at the beginning. Although we start at very early on to get your ideas together, and you will see that evolution of your own ideas throughout the modules and the 2 years of the course, but you're not expected to submit a proposal with your registration application.
Lovely. So one of the other questions that we've got before we finish, would somebody be able to work alongside the course? How much commitment is there for somebody who perhaps is working full-time, part-time at the same time as trying to complete the course?
Yeah, so it is obviously a part-time course. So as Mary mentioned, and I also covered, we have set days for residential weeks, most of which we try to span on a bi-monthly basis. So in terms of your traveling time and your booking off time from work. So we had a lot of full-time workers doing this course, and for either a professional development purpose or a career change. For the master's classes that is happening pre-residential and post-residential, all of those are online. Your interactions with your supervisor in the final year can also be arranged in an online way, although I had students who were around in Cambridge meeting the other people in their college or attending an in-person course that they decided they wanted to take. So they just send a message, arrange an in-person catch-up that I always enjoy. So it is up to you in terms of arrangements with your supervisor and outside course activities. But for the course, you will have the exact dates that will allow you to plan your presence in the residential days. Having said that, when you commit yourself to a 2 years course, there is obviously an added workload to your day-to-day job. We all know, we all have done it. So we require you to account for that level of focus required. If you're a full-time worker, make sure that you can achieve that balance with work, family, studies, all that. But yeah, apart from the residential days, we don't require you to be present in the classroom.
Great, thanks. And then one final question, is the course open to international students? So yes, we're absolutely open to international students. There's a little bit of information on the website about international and home fees, so do have a look at that. But as Fatima says, the residentials are bi-monthly, so it would be feasible for somebody to travel in on a visitor visa if that was necessary. And yeah, the pre and post masterclasses are, you know, online as well, and supervisions can be online, so it is possible to do it from overseas. So that sort of brings us to the end. If we can have the final slide. So yeah, so thank you very much for joining us, whether that's in real time or on the recording. It's been, hopefully you found this session really informative. If you've got any questions that you didn't have time to ask, or perhaps a little bit more personal for you, then please do feel free to get in touch with the enrolments team, and they will help out. We would love to hear your thoughts. There'll be a survey coming round, which will be emailed to you shortly. But otherwise, have a really lovely evening.